So people often ask then, well, if I'm going to get this IV therapy, what can I do to prepare myself so that I tolerate it really well? Well, one of the main things you want to make sure you do is you're well hydrated so we can get good access to your veins. Second is you want to make sure that you eat something before you come in, because getting all these vitamins can sometimes make your stomach a little bit queasy, and having some food in there is helpful as we speed up your metabolism a little bit. And so coming in and preparing yourself that way will be good. What are some of the side effects, or what are some of the things you can expect when you get an IV? The most common thing that we see in our patients when they get an IV therapy is they get tired, they get a little sleepy, they want to go home and take a nap. That's normal, that's common. As you continue to get the IVs, that happens less and less, and people actually start to feel more energized after getting the IVs than they do when they first come in. The other question that we get a lot is, well, how many IVs am I going to need? How long am I going to have to do this? And that's individual. Every person is going to be a little bit different. And depending upon your genetics and depending upon how well your cells can absorb those nutrients from the bloodstream, also determines how frequently and how well you will respond to the IV therapies. We have noticed that most people really see an impact on their lives after about 6 to 8 IVs. So you can expect to receive treatments for somewhere around, at a minimum, 4 weeks and probably a maximum of around 3 months to get an initial assessment as to whether or not the IVs are going to help you. Some people, that's all they need. They get 3 months of IV treatment, it puts them back onto their optimal health state and they're able to move on. Other people, however, are going to need longer periods of IVs. And sometimes we'll take breaks in order for patients to be able to have that opportunity to allow their veins to kind of calm down and to see what kind of a response they're actually getting from the IVs and see if they're able to maintain their health without the IVs.